Hi everyone, I'm Charlotte Kilpatrick reporting for Vaccine Nation from the World Vaccine Congress in Washington. I'm thrilled that today we're joined by Dr. Jules Millogo of Merck. Thank you so much for making time to speak to us again.
Thank you.
So for anyone who hasn't seen your previous interview, would you just recap your role within the organization?
My name is Jules Millogo. I'm a public health physician. I currently work with Merck Vaccine Division, and my role is to serve as liaison with the World Health Organization and to serve as partner to government or institutions that really work in the public health area.
Fantastic, thank you. So you're joining us for a panel on partnerships between industry and implementation programs. What are some of the key concerns that you're expecting to come up here?
The concern that I have, and I think it's shared by a lot of partners, is that sometimes the vaccines are available, proven to be effective, safe, sometimes for years, and still not reaching where the disease prevalence is the highest in the world. And my role within industry is one, to attract the attention of the company leaders, make sure that those countries that sometimes cannot afford the premium price, for the product, can have it, that we have mechanism to reach this population, but also work with the international organization, with country government, to prioritize the introduction of these vaccines. With all the priorities that there are, if you are working in some environments that are the most affected by these infectious diseases, preventable diseases, those are the same countries which also sometimes have ongoing civil wars, social disruptions, other major diseases. So it's not necessarily that people are not willing, it's just like they are overwhelmed. So it is our role as a community to facilitate, despite all or in addition to all these factors, to make sure that products that are life-saving can reach those who need it.
Absolutely. So you just mentioned the people who need them most, and quite a lot of these people are in underserved or under-resourced communities. What are some of the key challenges or obstacles that you and your colleagues face to getting these vaccines to those people?
Sometimes the challenges are purely logistic. You are where I was born, for instance, 50 miles distance can be 2 to 3 hours, like bicycle, motorbike, or vehicle, because there are no roads. And those 50 miles, sometimes it means that you don't have electricity to store vaccine, because most vaccine need to be stored in the refrigerator, 2 to 8 degrees, or even lower temperatures, or the personnel to deliver these vaccines. So those infrastructure challenges can be there. And then you have the barrier that can be the government prioritization of the product. It can be available internationally, but on a territory, it is not available because the government has not come around to introducing the product in the country. And we have vaccines that are proven to be effective since 2006, like the HPV vaccine to prevent cervical cancer, proven safe, really available in most sites and countries, but yet at this point, according to WHO, only 26% of eligible girls, we are not even talking other population, eligible girls are vaccinated at this point. It means that still you have more than 70% of girls that could benefit from the vaccine have not received yet. You have I mean, even a simple whooping cough. I mean, again, you have populations or children that have really, by the time they are 5, have received 0 dose of vaccine. And vaccines that have been around sometimes for 30, even 40 years. This is not acceptable. This is something that we all should be concerned about. Make sure we address these barriers. And I think we are getting there. Some things are improving, but we still have a way to go before we can say, you cannot die from measles anymore. We still die from measles. Some diarrhea from rotavirus shouldn't be, a concern anymore, but it is still. Polio, that's practically most people in Western countries don't even know how it looks like anymore, but it's still out there. It's not eradicated yet. So when you look at the world as it is, it's just like we are on the same planet, but there are still areas of the planet where it's a different world, really. I mean, that are not benefiting from all the progress made during the last century, really.
Absolutely. And the last time that we spoke, you emphasized the importance of building trust through effective communication.
Mm-hmm.
Can you tell us how receptive do you think the vaccine community, which is largely comprising academics, people who very focused on their scientific terminology and their experiments and their progress, are they receptive to taking on, okay, we need to be better at communicating? Do they listen? Do they try and learn?
I think it's really a challenge, and for us as physicians, public health experts, to adopt the language that people can trust and rely on. And it's not intuitive. And sometimes it's I don't think that it is on purpose. I was sitting in one of the sessions yesterday. I graduated from from medical school, but for practically 10 minutes, I had no idea what people were talking about. And they were talking health. I mean, but so people like to use these really elitist, words for something that you can really explain in very simple terms. I mean, you have to be able to explain to a 5-year-old that the disease is bad and the prevention is good. I mean, you don't need to put in so many expert words. I mean, it doesn't help anybody, and that's something that we have to work hard on it. Be mindful as experts, as physicians, or as researchers or academic, that sometimes we are not the best at communicating this information. We can use more tools, people, journalists or people in the community that can explain in the language that people can understand. And why it is important to take a vaccine, and it's not rocket science, really. I mean, but it takes a while. I mean, and some people are still not there. We think that we know better, but the reality is that we are not always the best at communicating. The wonderful things that we are doing.
Absolutely. So you just mentioned the wonderful things that you're doing. We're surrounded by people who are doing fantastic work. It's a privilege to see you at the Congress again. What are you here for, and what are you hoping that you'll leave having achieved this time?
I think it's always an opportunity. I mean, when you have people coming from all over the world to meet at one, to make connections that you wouldn't otherwise have, because we work in our silos. The circle I function in tends to be World Health Organization, UNICEF, some country ministries, etc. But Here you meet other industry partners. Most of the time you never heard about them, and establish connections that can help really to facilitate access to the product. Some are small developers that are not visible to Merck is a big company. I mean, the company I work for, but I mean, some of the small biotech, 200 to 5,000 people. Sometimes they are doing work that is not visible, that is not put forth, that can facilitate maybe in terms of presentation, packaging, even information to population, and make products more accessible to people. And that's sort of like one of the benefits of the instances like the World Vaccine Congress. Of course, I mean, there is the aspect of it, circus about it. I mean, because too many people in one place, finding, I mean, where to have a snack and whatnot can be challenges. But at the end of the day, it's a human connection that we are all trying to work toward a common goal where people don't die from preventable causes. Of course, I mean, there will be always, it's part of life, dying is part of life. But 5-year-old dying from measles nowadays, or having diarrhea that kills you when, I mean, a few drops would have prevented, or, I mean, you name it. It's really disheartening when it happens, and we shouldn't see that anymore.
No. Well, I hope you have a really productive and enjoyable stay here. Thank you for joining
We
us.
hope.
Thank
Thank you
you.
so much.